It's time for the Source's weekly check-in with Derek McNally from Niagara Health. Derek, welcome to the program once again. Derek, it's nursing week, and I want to talk to you a little bit. I hope you're okay with this. I want to talk a little bit about your career as a nurse, because that's where your background is.
When I started my nursing training, I was one of 6 male nurses, as we were called, in my class, and I actually trained in the Glasgow Northern College of Nursing and Midwifery. So that's where I did my training there. And so when I graduated there, I worked in what they call casualty over there. We call emergency here. And I worked there for 2 years as a staff nurse, and then my wife and I immigrated to Canada, and then I started my career in Canada as a staff nurse at Toronto East General Emergency in Toronto. Worked there for a number of years, and then I moved to Humber Memorial into my first manager job, and then I went to the Hospital for Sick Children in Toronto, where I was the manager for emergency and trauma services there for a few years. And so most of my career I've worked in emergency. Went from sick kids to Credit Valley Hospital because it's close to my home in Mississauga, and then went to St. Joe's in Hamilton and worked there for 10 years as a director. Went to Trillium Health Centre after that, worked as a director of nursing, and then came to Niagara in 2012.
What brought you to Niagara? What was the decision maker?
So as you'll recall, back in 2012, the hospital was under supervision with Kevin Smith. And so I came down to work with Kevin and the team here to do some work in Niagara Health. As you know, they had gone through a number of problems. And so basically, Kevin asked me to come down and do some work with him and the team here.
You've had experience in management, in nursing for a lot of different hospitals. What can you say about nurses in general during nursing week here?
Nurses are the heart of the work that we do in healthcare. The way nurses practice and the caring and the compassion and the sensitive care they provide, and they provide that whole range of care, right from newborn to elderly end-of-life care. It goes back to, Florence Nightingale. It was her 200th birthday yesterday, and that's why the World Health Organization named this year International Year of the Nurse and Midwife. And so very proud to be a nurse. I think nursing is the heart and soul of the work that we do every single day.
What does Niagara Health do during nursing week, and what can we do to recognize the contribution that nurses make?
We always have a number of festivities, if you will, to celebrate Nurses Week. We have usually an awards ceremony, Nursing Week dinner, etc. But of course, in these times, we are not able to have any of those. So we recognize our colleagues. As you may know, last evening, to celebrate Nurses Week and to celebrate Florence Nightingale's 200th birthday, all of our sites were lit up blue. We had a blue light lighting up our sites. The bridge over the Welland Canal was lit up blue, and Niagara Falls was lit up blue in support of Nurses in Nurses Week. Our nurses inside our 5 sites across the organization, because the community has been so supportive, they're actually going to give back to the community. So all the sites are picking a charity or two, and they're actually going to donate back to the charities in the community for Nurses Week.
There's a great story on the Niagara Health website about a young nurse fresh out of nursing school.
I can't imagine starting my career right out of university into a pandemic. And speaking to her manager, Jackie Flahos, Jackie told us that she's just an outstanding nurse. She's a new grad. She came in. She's extremely sensitive and compassionate. She works very, very hard. She wants to learn, but out of school, into a pandemic.
Derek, thanks for your time again, and I want to wish you a happy Nurses Week, and thanks to all of the nurses from all of us here on your TV.